This is Health UnaBASHed, broadcasting live on Healthcare Now Radio. Health UnaBASHed is a conversational platform where healthcare meets innovation. We engage top industry talent and dive into the heart of health and wellness, from vision to business model, to bring you the latest developments in health tech, from promising AI applications, policy, to ultimately meaningful impact on the public's health and well-being. I'm Gregg Masters, co-host and executive producer, and am joined by the digital health aficionado himself, author, editor, global thought leader, and in his executive capacity, steward servant Gil Bashe. Together, we're on a mission to bring you the people, the ideas, and the companies that are not just talking the talk, but walking the talk. On today's menu, we are in the company of Susannah Fox, author of Rebel Health, a field guide to the patient-led revolution in medical care. Susannah is a champion for patient empowerment and an advocate for leveraging the power of networks to advance health and care. With an extensive background in health innovation, Susannah has inspired healthcare organizations to focus on listening to and learning from patients, and her work emphasizes the impact of communities on health outcomes. So, Gil, with no further delay, the mic is yours.
Gregg, I want to thank you tremendously for that great introduction, and more importantly, for introducing me to Susannah Fox, our guest today. We've been chatting probably for the last half an hour, and I'm just overwhelmed and impressed. I think this is a very important conversation, and I want to thank you again for setting this up. Just for everybody who's tuning in right now, Susannah Fox is she's known as really a health and technology strategist, but she's much more. She's really been involved in the sector of technology and health for quite some time, with Pew Research, of course, her work there. She was she was Chief Technology Officer at Health and Human Services, and then was the entrepreneur in residence with the Robert Wood Johnson Foundation. She's had a tremendous impact on our nation's health and well-being. She's really on the front pages right now, or certainly on the main stages, because of her best-selling book, Rebel Health, a field guide to patient-led revolution in medical care. That's published by MIT Press. Susannah, thank you so much for joining Gregg and me today on the program. We very much appreciate it. And by the way, it's a great book. It's a needed book. I said to you in the very beginning, as we were kicking off, obviously, one of the revolutionary books was Eric Topol's The Patient Will See You Now, which kind of was a mindset or a shift in conversation to doctors of saying, don't think that you can have patients sitting there in your waiting room for 90 minutes patiently any longer. That day is come and gone. But you have done something special. I mean, you've created the complement to the aspirational or philosophical book. You've created the operational, practical handbook for people who are in the system and facing health concerns. And you've done it in a unique way, which is emblematic, I think, of the health system, which is you're not alone. You can't possibly survive as a soloist. Well, you can, but it's difficult to survive as a soloist when you're facing a health challenge. People should run out and get the book. First of all,
thank you.
We're always people, but we're all going to be patients at some point or another. So better to study this book before you really need it, as opposed to when you're in sort of like the thick of all things. But I wanted to first ask you, what motivated you to write this specific book? And obviously, Rebel Health Revolution, you cut to the chase. A lot of us use these polite words. We need to have a transformation. We need to have change management. You boom, revolution. So I wanted to ask you a little bit about what was the spark behind this great book?
This was a book that I felt responsible for. So many thousands of people had shared their stories with me over the last 20 years in my field work in communities of people living with rare disease and life-changing diagnoses. I felt responsible for sharing what I learned from them with everyone else, whether you are a patient, a caregiver, a survivor, or if you're a healthcare leader. We can learn from these revolutionaries. And that rebel language comes directly from people that I interviewed for the book. The word rebel just kept coming up. And I also want to give credit to my mentor, Tom Ferguson. He was someone who was a Yale-trained MD who immediately set out to give people the keys to their own health. He saw health education like driver's education. And he was somebody who early on, when he was a mentor to me, he said, if you want to see the future of healthcare and technology, go out to the frontier, hang out with the cowboys and the artists, the people who have to make their own tools because they don't exist yet. And that turned out to be people living with rare disease and life-changing diagnoses like HIV, ALS, insulin-requiring diabetes. And that's really where I've learned the most.
Well, it's so true. I think of some of the advances we've seen in rare disease have been, I think, inspired or sparked by the patient community. I certainly became a health communication, or I call myself a for-profit public health professional. But when I think back to the AIDS crisis, and I'd be in meetings with companies, and I'd get out of the meeting, moments out of the meeting, my phone would ring, and I'd be speaking to some of the AIDS activists, and they would know what happened at my meeting of 6 people, before I even got back down the hallway to my office. So they had built up a great intelligence network, and I think it made people realize, because once upon a time we kind of shut the patient out of the conversation, right?
We certainly tried to.
Yeah, look, the AIDS population is a great example of that, which is, they'll do what we tell them to do. I often say, I don't know what your reaction is to this, that, people say the center of the health system is the patient. And I say, no way. The center of the health system is not the patient. That's the problem. The center of the health system is the system. The system is the customer of the system. And it's the beast that thrives from every decision that's made. You've been in that system. I mean, you have been at the core of information for HHS. So I don't want to put you in an uncomfortable spot. But your book gives guidance to how people with health concerns can, I mean this gently, work the system to survive.
Yeah. And I love that you brought up the AIDS activists. Anyone who wants to step into their power as a patient, as an advocate, as a caregiver, is stepping into a tradition that is decades old. And I was able to trace back to the beginning of the 20th century, patient-led radical health movements that we now borrow from. Things that looked radical before become mainstream. And that's one of my messages, that things that feel radical today, for example, patients using AI to self-diagnose. That sounds really radical. That's going to become mainstream. That's what we can learn from the rebels of healthcare today, just as we learned from, for example, I like to point to Alcoholics Anonymous, founded in 1935, because it was substance use disorder was ignored by mainstream healthcare. And so people turned to each other. There's an example in every decade of the 20th century. And now leaders have the opportunity to learn from the people who are bending the rules, breaking in and taking what they need from healthcare. And if you find yourself dropped into the healthcare maze, know that you're not alone. There are people who would love to help you if only they knew how to find you.
Yeah, I worry about that, because for people who have the best insurance, sort of like PPOs or so forth, as opposed to HMOs, they have a lot of selection and choice. I don't think they know how to use the choices they have because no one trains them on that. But for people who have HMOs or Medicaid, not Medicare, but Medicaid, I think that those people who have the highest degree of needs have the lowest degree of access and care. I mean, it's counterintuitive. Does your book touch on like what to do for the people who have sort of like the affordable care level insurance? They I think need to be most revolutionary if they're going to make it.
So what I decided to do is focus on people whose needs are not being met by mainstream healthcare and who feel invisible. That is a huge group of people. These are the people who are not really yet served and that we need to serve as a country and as a system. And by the way, people who are invisible and their needs are not being met, they're probably innovating. Here we're talking about people with physical challenges who are building their own assistive devices. Here we're talking about people who want access to their device data, so they break in and take access. They basically jailbreak their medical devices to get access to that data. So something that I really want to emphasize is that when leaders in healthcare look at the quote unquote underserved, don't only see scarcity, see an abundance of innovation, because these are probably people who have had to invent workarounds. They are inventive because they've had to survive. What if we look at that and say, let's learn from them as much as we think we have to teach them?
Probably have more to learn from them than teach them, I have a sense. But you've collected, you mentioned hundreds of stories that inspired you to write the book. I'm sure you've been asked this question before, but not here. What 2 or 3 stories do you think about where you say, I was inspired then, but it's more relevant right now than ever before?
Oh, man. One of my very favorite stories is a story of a baby born who had full facial paralysis. This was actually early in about 100 years ago now. It was in the 1920s. And the family was told, we're sorry, there's nothing we can do. You should put your baby in an institution. You should just say goodbye and go on with your lives. That's how people with disability were treated for much of the early 20th century. But this family said, no, we're going to take this baby home. We're going to figure out how to feed a baby that has full facial paralysis, which is kind of like cleft palate in that the baby can't close their lips to suck on a bottle or a nipple. They figured out that this child had no intellectual disabilities, and the family forced the school system to take him, and he completed college and joined the family business in Milwaukee, Wisconsin. I heard this story from Nell Minow. His name was Bert Minow, and he was Nell Minow's uncle. And he never knew what his diagnosis was until probably the 1970s or 80s, that it was Mobius syndrome, very rare, 1 in a million disease. And Nell used to test search engines. And she was an early internet user. And so she would Google Mobius syndrome just to see what came up. One day she found a website, a group of families with babies and toddlers with Mobius syndrome had gathered together to trade information. So she wrote to them, and they excitedly wrote back, how old is your uncle? And she said, he's in his 70s. Well, the medical literature at that time found that people with Mobius syndrome only lived into their 30s. And that day, hundreds of families all across the world found out that their children could live a typical lifespan. And Bert Minow found out that there were other people like him. And that, to me, is a story about isolation. It's also about resilience and grit of these families to say, no, we are not going to institutionalize this child. We are going to bring them home, and we're going to care for them, and they're going to thrive. And it's now a very strong international community. The Mobius Syndrome Foundation brings people together every 2 years. It's a community of innovation.
Just dropping in, you're right on time for Health Unabashed on Healthcare Now Radio. Today, we're chatting with Susannah Fox, author of Rebel Health, a field guide to the patient-led revolution in medical care. Stay tuned for the rest of the story.
So another story that I like to tell is a more modern story about people who were cut off from access from the data that could save their own lives. And here I'm talking about continuous glucose monitor data.
Right.
And John Kostick was a dad in upstate New York who would set alarms all throughout the night to stumble down the hallway and check his 4-year-old's continuous glucose monitor screen to make sure that his kid, the blood sugar was in range. If it was not, he would take action. But if it was, he would go back to sleep. This grew tiresome, as you can imagine. And so he said, I'm an engineer. Maybe I could figure out a way to get the data from the CGM onto my Apple Watch. So if I wake up in the night and check, and if he's in range, I could just turn over and go back to sleep. So he did. Well, this set off a cascade of innovation. And now CGM data access is standard because it was Rebels. It was the Diabetes Rebel Alliance that broke in and took what they needed. Why did they have to break in? The medical device companies have traditionally seen their customers as the prescribing clinicians, not as the patients and caregivers who are actually living with these devices. But I want to say, and I'll let you break in a second.
No. Please.
I'm on a roll, and I'm just going to say, diabetes device data stands alone. There are so many medical devices that are still locked down, and patients are kept out.
I was thinking of that because I'm very familiar with the blood glucose meters, having worked on some of the first smaller ones. And I think about a regulatory entity, and here you're talking about patients hacking technology to get the application that they want, and companies living in horror and fear that they're going to be slammed by the agency, Food and Drug Administration, for letting patients or consumers hack their devices to get what they want. And so there's this awful sort of catch-22 that goes on, which is smart patients can innovate. Companies could then, for patent the application, make it available, apply for the indication of use, like Apple Watches has on many different uses of the application. But at the same time, because the device is hackable and used for medical implication, the company might be held liable, and therefore they do everything they can to lock it down. And is this
the patients broke into a minefield? Let's just be honest. They broke into a minefield, and they were willing to do so because
the patients did, and I think the patients got themselves out of a life-threatening minefield.
Exactly.
I think they dragged the companies into the minefield, and the companies are saying, "Get me out of here." But
it's a beautiful story because it's a story of people who said, and you probably know this hashtag, we are not waiting. We are not waiting for the industry. We are not waiting for the government. We're going to create these solutions for ourselves. Afford to.
But my question is, can the agency, which I think is loosening up, say, look, if someone hacks your device, they're responsible for the information outcome, not you. There's no such thing as an unhackable device. Or else we'd have security software. That would be the end of it. So, this is the place where, how does this fragmented health ecosystem of policymakers, regulatory folks, and hospital systems, and policymakers, and product innovators, and people, how do we find some way to live in harmony with each other? And the kind of the rhetorical aspect of it is, can we? Because people who have health issues, they can't afford to wait, right? The clock is ticking. This poor father's sleep is non-existent. He's living in a state of heightened anxiety 24/7. And he doesn't want to do that. And he has the ability to hack the watch, connect it to the device, and live a life.
And here's the thing. The patients and caregivers exposed a market opportunity. They exposed a way that medical device companies could open up a whole new sector of innovation. And at first, yes, the device companies pointed to the FDA and said, patients, you can't do this. The FDA is going to come down on us.
Right.
And so this brilliant woman named Amy Tenderick started holding an annual conference where she would bring together the medical device companies with the hacker cowboy patients and caregivers and representatives from the FDA. And she would say, let's all gather together and talk about what's going on here. And the FDA took a look and the device companies took a look and they said, okay, we're starting to understand this. We're starting to see the possibility of letting people have access to their own data. And what's really important here is that the patients were teaching each other peer to peer for free about how to do this. And so all of the early innovation, and by the way, this started in 2013. So while it sounds radical and new, it's over a decade old. The FDA actually only has purview over things that are commercialized. So since the patients weren't charging money for the expertise that they were sharing freely, the FDA, couldn't come down on them. And when either the device companies or the FDA said to the patients and caregivers, hey, what you're doing is dangerous, the patients and caregivers had the perfect comeback. You know what's dangerous? Living with diabetes. We're making it safer. Join us.
Bravo. I think that if your work inspires a wave of consumer-oriented improvements, hacking, we can call it, society will benefit. It's amazing how two people in a garage can invent a movement. And by the way, you and Packard did it in a garage. I think Apple did it in a garage.
Google started in a garage.
I don't know if Bill Gates did it in a garage, but certainly I have a large garage I'm willing to rent out to would-be innovators and to change for the sake of changing the world. Most certainly, my cars don't have to go in there. If you have a life-changing idea, use my garage, please.
And now it's a virtual garage, right? Like the workspaces that happen are happening online. And actually one of the market opportunities that I see is that so much of this is happening on Facebook. And Facebook was not designed to be a health platform.
It's amazing. Facebook groups for patients is becoming the meeting ground. I do participate in some of those groups. You're spot on. I think that people value community. And I do see people asking questions about where to go, what to do, about what was your experience. This is so invaluable. So, it's hard to believe that a show goes in a blink of an eye. And it's probably because you're amazing. So it went even faster. I've never seen 26 minutes go by so quickly in the 4 years that this show has been airing on Healthcare Now Radio. But we have a few moments left. I wanted to ask you, you're doing great things. You're an advocate for people who really need a voice of reason. You've been in the system. You're an advisor to, I think, Cambia Health Systems and other great groups like that. You're speaking. You're doing many things. What's the next thing on the agenda? Where can we hear you? Where can we see you? Is there another book in manuscript form that we should know about?
Thank you so much. Right now, I am still on a listening tour. I am dividing my time between general public events and talking to leaders in every sector of healthcare. And I want to tell you that when I speak to patient groups or I speak to a general audience, at every single meeting, someone gets up and says, I'm angry that you wrote a book about the patient-led revolution, and you are not actually calling for an overthrow of the American healthcare system. There is so much anger about access, about cost. And I think that we in healthcare need to pay attention to that. I said at the top about how I focus on people who feel invisible and whose needs are not met. There's a lot of opportunity for impact in helping those people. And I'm just going to also point to that there are market opportunities in that sector as well.
It's amazing. I travel the world. I see systems that actually, obviously smaller countries, but their systems and access to care and access to timely care are so much better than in many cases what I see here. We're the world's richest nation and certainly one of the world's most advanced nations. And yet, I think that our system centers around, as I said earlier, the system. I would encourage us to stop looking for villains in the system and realize it's the system that's the villain, not any one segment of the system per se. It's not payers, it's not doctors, it's not product innovators. It's the structure. We have a structure that was created post World War II. And on the heels of making health a corporate benefit, and now we're kind of like stuck in between an old world and the need to make a transition. I don't know if a complete revolution is necessary. I think that your wise words of listening and on a listening tour perhaps is the best thing for all of us to do. But I hope that when you finish listening, you'll realize the system has to look at what's valuable to the people we're trying to help and prioritize the value as opposed to the system. Rebel Health is a great book. It's a great work. I recommend everybody go to Amazon and order their copy, listening to the show. I think whether you're from a pharmaceutical company or a medical device company, a great tech company like Apple or Microsoft or so forth, read the book. I think you're going to get a good understanding of the power of technology, information, and health when they align. And Susannah, I think that why do I think that if you stop listening, we might find you back in public service again? Obviously, you have a propensity to want to help people. So I hope that we put you in a situation where you can do that the best. It's been a pleasure having you on the program.
Thank you for having me.
And that, dear listeners, is the last note for today's melody. And a huge thank you to our worldwide audience for tuning in. And tip of the hat to our special guest, Susannah Fox, author of Rebel Health, a field guide to the patient-led revolution in medical care. Susannah is an advocate for patient-led innovation, inspiring us all to reimagine healthcare from the perspective of those who matter most, the people it serves. Her insights remind us of the power of community, collaboration, and human-centered care in shaping the future of health. Do follow Susannah's work via www.susannahfox.com or on Twitter via @SusannahFox. Health Unabashed streams live 3 times a day on Healthcare Now Radio, Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern, and that's 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Do stay social with Gil and me on Twitter via @Gil_Bashe, and that's BASHE. And Gregg Masters, MPH, and that's Gregg with 2 G's. And don't forget to give your tweet some zing with our hashtag HealthUnabashed. Until we meet again, pursue your passion for better health and with no apologies.